Hi, I am Dr. Rakesh Chincholikar Kulkarni. I am a consultant pediatrician and neonatologist working at Cloudnine Hospital, Pimple Saudagar branch, Pune. The basic newborn care from the delivery room. We should take care of each and every baby as it is very precious for the parents. Now, basic newborn care, it starts from the temperature. So, we have to maintain the delivery room temperature. We have to keep one warmer and we have to keep the baby warm under that. Immediately after delivery, we take the baby in a clean surface, that is a clean towel, and that we have to protect from the hypothermia. We have to assess the baby, how is the cry of the baby, what is the color of the baby, whether the baby is breathing properly or not. Accordingly, we have to plan next program of the baby. Now, along with this, the hypothermia, we have to clean the baby immediately. We have to assess the baby. What is the Apgar score that we need to check? We have to check the weight of the baby and we have to put a batch to the baby. Also, along with that, we have to give vitamin K. Vitamin K is very important to protect from the bleeding to the baby. Along with that, we usually give hepatitis B vaccination as early as possible or in the delivery room only. That is the important thing. Next thing is we have to assess the baby. Is there any abnormality in the baby? Is there any congenital problem is there? We have to check the oral cavity. What is the head? How is the head? How are the eyes? We have to clean the eyes from inner to outer side. We have to check the oral cavity. Is there any cleft lip or cleft palate? We have to check the ears, both sides. We have to check the upper limbs, number of fingers. We have to see for any cardiac problem. We have to see for the genital area, anal potency, and the most important is the umbilical cord. Immediately after delivery, we have to put umbilical cord clamp. So we have to practice the clean hand, clean surface, clean cord, clean tie, and clean cord. That is the important thing. After that, we have to check the weight of the baby and we have to put the batch. That is the important thing. And we have to take a fingerprint of the baby. Yes, after that, we have to initiate the breastfeeding as early as possible. After that, in the duration of the hospitalization of the baby, that we have to see whether the breastfeeding has established or not. After that, daily weight checking must be there. We have to analyze for jaundice, which can generally ideally appears after 24 hours. Before that, if it is there, we have to see the baby clinically. Also, we have to see whether the baby is feeding well or not. Urine and motion, first motion is called as a meconium. That also we have to see whether the baby is passing normally urine and meconium also. We have to establish the breastfeeding, and at the time of discharge, we have to take care of the basic vaccination in the form of BCG, oral polio vaccine, and hepatitis B. Along with that, hearing checkup needs to be done before discharge. And before discharge, after assessment clinically, we have to see the jaundice, and if needed, you need to check the bilirubin level also.